According to International Diabetes Federation, 537 million currently people are living with diabetes, which means 1 out of 10 are currently living with diabetes. Assalamu alaikum and very good afternoon to all the viewers. This is Dr. Asya Nabi, a general practitioner and an assistant medical director from Prime Healthcare Group, with you through our official Facebook and YouTube page. Access to diabetes care, if not now, then when, is the theme for World Diabetes Day today. They are extending it till 2023 as well. With this, before I introduce our first speaker of the day, in the meantime, I would like to ask all the viewers there, what is the biggest challenge they are facing currently in treating diabetes, or not knowing anything about diabetes, any hindrance in the treatment or in the management part? Please write in the comment box so that we can answer. Uh, I would like to introduce our first speaker for the day for this diabetes talk. Dr. Mohammad Nabil Mahna is a specialist endocrinologist. Good afternoon, doctor.
Good afternoon, Dr. Asya, and good afternoon to all.
Dr. Nabil is holding a master's degree in endocrinology and metabolism from Shams University, Cairo, Egypt, with extensive experience of more than 80 years. He has not only worked in UAE, but before coming to UAE, he has also worked in Egypt and Saudi Arabia. We have our next speaker with us. He's a consultant nephrologist, Dr. Sandeep Verma. Dr. Sandeep Verma has an extensive experience in the field of nephrology, or we say in easy language, all and everything about kidneys. Is a DM nephrology, has extensive experience in dialysis, critical care, renal transplant or kidney transplant and whatnot. Good afternoon, doctor.
Yeah, good afternoon, everybody. Yeah.
Our next speaker, Dr. Lilan Butt, specialist ophthalmologist at Prime Healthcare. For her, I would really like to say something. It is more than 2.5 decades in teaching institution as associate professor and professor joint director of Eye Association of Kerala for more than 10 years. Our areas of expertise, anything, everything about eye, and besides cataract, cornea, retinal issues, and glaucoma, you can always reach to her. Dr. Leland Butt is with us at Prime Healthcare Group. She has joined from Prime Hospital. Good afternoon, doctor.
Good afternoon to all of you. Thank you.
Now we have with us from Prime Medical Center 06 Mall, Dr. Wissam Wahid, specialist cardiologist in general cardiology, cardiac imaging, and non-invasive cardiac testing. Good afternoon, doctor. Heart health and diabetes has a long way to talk. We are going to talk today about it. Good afternoon once again.
Good afternoon, Dr. Asya, and good afternoon to all your fellow colleagues.
Thank you, doctor. So topic is vast. It's a multidisciplinary approach. Diabetes not only affects one person, definitely the whole family. There are certain important points what we want to discuss. But before we start the discussion, I would really like all of you to know one very important thing. Whatever we are going to discuss, during or after the session, we will be asking one question for you to win an annual health package. Now be very attentive during the session. You may be that person who will be winning, but of course the right correct answer. So Dr. Nabil, I'll be starting the topic with you. Actually, in brief for all of us, what is diabetes and who is at risk?
Diabetes mellitus is one of the most common chronic disease all over the world. And as you mentioned, that the number of people who are affected by this disease all over the world, it is between 400 and 500 million. Also, diabetes is the principal and the first cause for blindness, amputation, and renal failure. Yeah, simply diabetes means elevation of blood glucose levels due to lack of insulin hormone secretion from pancreas. And as everybody knows that diabetes is divided to type 1 diabetes and type 2 diabetes. Type 1, which is named insulin dependent, which is usually affecting children and teenagers, and it is due to autoimmune process which happen in the body without any known cause. Suddenly, antibodies appeared on the patient body, attacking the pancreas, causing failure of insulin secretion. Also, some theories is telling that the cause may be viral infection also. While type 2 diabetes, the cause it is either dysfunction in the pancreas, also same like type 1, or maybe the cause is insulin resistance. This is very common cause, and most of the people who are type 2 diabetes, the cause is related to obesity and insulin resistance.
And Doctor, who is at risk? Briefly, if we can just list down some of the most important risk factors that people should be really careful about.
Again, doctor, I cannot.
Who is at risk for getting into diabetes? Probably people are already in the pre-diabetes, and what is the risk towards diabetes?
Yeah, of course, the people who are at high risk for diabetes, the people who have family history for diabetes. And usually, positive family history for diabetes is a risk factor to develop type 2 diabetes. Also, the second cause which is responsible is the lifestyle. And most of the people, they are not doing exercise, they are not following diet plans, they eat junk food, carbohydrates, cola. So all this is responsible for developing of type 2 diabetes.
All the people there, please be very careful if you have already a family history and type of diabetes, if you're obese, and specifically your lifestyle matters a lot. Uh, Dr. Wissam, I have a question for you. How is the risk for any heart disease assessed based on diabetes or any other risk factors?
Okay, when I start talking about diabetes and cardiovascular disease, I have to mention two important facts that all patients have to know. First fact is that cardiovascular disease is the number one cause of death worldwide. And when I talk about cardiovascular disease, I have to mention that also out of 100 patients, I have 30 patients who have diabetes. 30 patients who have diabetes have also cardiovascular disease. So diabetes as it on its own is an independent major risk factor for cardiovascular disease. So that's why when I'm assessing a patient with diabetes for cardiovascular disease, I have to consider this fact, because diabetes is, as you said, is not a disease that will affect only one organ. It's a disease that will affect many systems. It's a systemic disease. So when I'm approaching a patient with diabetes and I'm suspecting that he's having cardiovascular disease, I have to ask myself mainly three questions. The first question is this patient with diabetes, does he have any other risk factors or only diabetes? And by other risk factors, I mean high blood pressure, which is called hypertension, high cholesterol. Is this patient a smoker? Is he advanced in age? Or does he have family history of cardiovascular disease? And these questions I have to answer, because the more risk factors he has, the more at risk he is already, apart from diabetes, which we said also is a major risk factor. The second question I have to ask myself is, if this patient with diabetes, has diabetes already affected his heart already, or he's still safe, or he did not develop any complications from diabetes regarding the heart? The third question I have to ask myself, has diabetes affected his other organs? Because as we said, it's a systemic disease. It's not just a one system disease. So I have to ask myself all these three questions. And to have an answer for all these three questions, I have to take a detailed medical history. I have to ask the patient about his symptoms. Does he have any chest pain? Does he have any exercise intolerance? Does he have any swelling in his legs? I have to ask if he has already previous medical history he's being treated from. Is he known to have high blood pressure or high cholesterol? And I have to check for those because sometimes the patient is not diagnosed. He doesn't know that he has high cholesterol or high blood pressure. So I have to do my proper assessment and investigation for that. Even though in diabetic patients, I have to be very, very aggressive in my investigations. I have to do targeted assessment or targeted investigations for the heart. I have to do an EKG. I have to do an echocardiogram, which is an ultrasound scan for the heart. And if I'm still suspecting, I have to do further assessment for the heart till I can either exclude or confirm the patient has any cardiovascular disease.
Thank you, doctor. I just, since you have already mentioned, out of your 100 patients, 30 patients are already diabetic. I want to know the, brain, like most of the people who are diabetic, are they coming because they want to get their heart checked? Are they the cross referrals from the other specialist, or people are generally aware that they should get their heart checked as well?
Unfortunately, I've worked in many countries. Unfortunately, not all patients are aware that diabetes can affect their heart. They mainly think that diabetes is just a disease that I have to take some medication, some insulin, I have to stop eating some sugar. But they don't know that diabetes can affect all their organs and the blood vessels of the body all over. And diabetes is a duration dependent disease. Like the longer you have diabetes, the more at risk you are. So yeah, patient needs to be aware of this fact that if you are a diabetic, then you have to be regularly followed up. You need to check you have to do especially a heart checkup.
Definitely, doctor. We'll discuss this in a separate part. Dr. Sandeep, I want to ask that most of the people, because I'm also a general practitioner, I have seen most of the people now have at least this kind of knowledge that diabetes can affect kidneys. First of
Yeah.
all, I want you to explain to all the viewers and all the patients who are living with diabetes that how can diabetes damage the kidney? This is very important for all of us to know at this point of time.
Yeah. As our previous speaker, like our cardiologists have told, diabetes is the complications of diabetes are predominantly duration dependent. So diabetes, if it is a long-standing diabetes, especially with uncontrolled sugars, then it kidneys, what we call as the subunits of kidneys, are what we small filters are there in the kidney, and these become progressively damaged, thickened and damaged, and the filtration comes down. And also then we start to have more of protein in urine, and slowly and slowly, steadily there is an increase in creatinine, like a deterioration of kidney function in the due course. So yes, it is a duration-dependent disease, duration-dependent complications of diabetes, and among other complications of diabetes, uh, kidney disease or diabetic kidney disease, or what we call as diabetic nephropathy, is one of the most important thing, and which determine the prognosis of the patient. Because, as you know, when kidneys starts to get affected, uh, all other organs are directly or indirectly related with the health of each other, actually. So naturally, the cardiac risk increase when renal health is impaired, and vice versa. So when kidneys are affected, actually the prognosis for the patient is generally affected, especially even from the protein leaking stage, that is microalbuminuric stage. We have seen this increase in risk, not only when the kidney has really got damage, even from early stage, we tend to see this association. Yes.
Absolutely, doctor. Like, it, as you said, that if the person is really affected with kidney disease and all the medicine also has to go through either liver or kidney, what is that one very important sign that, a person living with diabetes but has never visited a nephrologist, that should incline him to and persuade him to that this is enough that I should see a neurologist? What is that important message for all the diabetics to know?
Yeah, see, that's a very important question. The thing is that in diabetics as a whole, or for that matter, any person or any patient, if the kidneys are slowly getting involved, actually there may not be any symptoms. So that is an important thing which we have to keep in mind, because only screening can bring out the disease in us. So that is why for all diabetic patients, as per our guideline, we advocate a yearly checkup of urine, just like urine microalbumin, like creatinine, and even cystatin C. So of course that comes to the screening, which is by which at least 60 to 70% of diabetic nephropathy, diabetic kidney disease are actually found out by screening. But of course, there are many patients who actually come to us when they find swelling in the limbs, swelling in the legs, especially after a long travel, which or sitting for quite long, which many people don't take adequate care, because when we take the history, we would know that okay, this swelling, off and on swelling has been there for the patient even for past many years, which they have not noticed. So if they have these kinds of swelling either in the face and they wake up in the morning, or in the legs when they, if they are sitting for long, that is the thing which should make them doubt about possibility of a kidney disease underlying. And of course, other symptoms like if there are muscle cramps, in patients who are, especially in patients whose sugars are not controlled, and nowadays it is getting well controlled. Many people are happy, but one thing which we have to think about this in this condition is that whether there is a impending renal dysfunction. Because when there is a renal dysfunction, there can be spontaneously the sugars can go down. So patients should be more careful and wary rather than becoming happy. And their sugars all of a sudden starts to improve without any additional medicines. And then development of new onset of hypertension. All these things give us an idea that okay, there could be an impending kidney involvement coming, and then it has to be tested. Yeah.
Thank you, Dr. Sandeep, for this precise answer. All the viewers, please note, if you are not going to your, primary physicians, if you are not going to your endocrinologist, if and you are feeling any of the symptoms what Dr. Sandeep just mentioned, make sure at least you take any of the health package. We generally have a lot of things which will tell about your health. Dr. Leland Bhatt, Doctor. I want to know from you, because many of the people will never understand that diabetes has a major role in eye health. By the time they reach back to the doctors, it is probably late. I want to know from you, what is the concept overall from people about diabetic retinopathy, and in simple terms, how do you want to explain to your all the viewers?
I think the first step is the physician and the endocrinologist. I think almost all endocrinologists send the patient for a routine and a baseline eye checkup. But I find that the physicians who are treating the diabetic patients, either they are too busy, or I don't know, they're not sending the patients. It is their primary duty to inform the patient that you need a mandatory annual eye checkup. So the first step is from the physician, because very often the diabetic patients may be asymptomatic from the ophthalmic point of view. They may have no symptoms at all, but when I see if on a routine checkup, they already have moderate diabetic retinopathy. So, and some patients may come with saying they have floaters in one eye, or occasionally it may be profound loss of vision in one eye because of a bleed. And only then they realize that they have proliferative diabetic retinopathy. So, which perhaps could have been halted with timely treatment. So, and occasionally the patient may come with a sudden onset of diplopia because of a third nerve paresis, which happens quite often in the older diabetic patients who are not under very good control. So, just to reiterate, the primary responsibility of the physician or the endocrinologist or the nephrologist to have their baseline and annual eye checkup.
So, doctor, if there is no symptom, one is as per the recommendation, definitely a person, diagnosed with diabetes, when should he or she first visited the ophthalmologist if the primary physician is not referring the patient?
So, at the time of diagnosis, at
Yes,
the
very
time
good.
of diagnosis should be the first visit to the ophthalmologist, whether or not they have any symptoms at all.
So whether or no symptoms, doctor, what will patient expect from an ophthalmologist to see? Simply, he will come to the OPD and say, "I have been recently diagnosed with diabetes." What will be your approach towards patient? And if because this is the right platform to explain to all the viewers, probably the doctors also, that what they will expect from you.
So the traditional examination will include a visual acuity. Okay, so and a slit lamp examination. So the slit lamp examination, we can pick up new vessels in the iris. We can look at the pupils, whether they are brisk. And sometimes there can be unexplained vision loss in one eye. So when we see the fundus, there may be some macular ischemia or macular edema, which even the patient may not have realized. So that is the traditional examination. Now the other techniques include optical coherence tomogram, which is like doing histopathology of the macula and the retina. And nowadays, with the help of even artificial intelligence and fundus pictures, so this wide angle fundus pictures will document. So even if the treating physician is unable to interpret with these fundus pictures, which can be sent even to the referral hospital for an opinion. So those are some of the newer techniques where use of artificial intelligence, teleophthalmology, and wide-angle photography. Of course, the traditional examination is a must. The baseline visual acuity, slit lamp, and dilated ophthalmoscopy.
Thank you, doctor. That was very, very, very important information. So all the viewers, all of the physicians, please start, at least guiding the patients properly. That ophthalmology checkup is one very important thing at the time of diagnosis. Coming back to Dr. Nabil, Dr. Nabil, I want to know what should be anyone's blood sugar when they wake up, not diabetes, but in general, and before meals and after meals. So at least a quick reading report for anybody non-diabetic and anybody with diagnosis of diabetes.
Generally, fasting blood sugar when you wake up, it should be between 70 and 100. Okay. Random blood sugar at any time of the day, it should be below 140. Okay. So if your fasting sugar is above 100, so you have to start suspicious. يعني, levels from 101 till 125 for the fasting blood glucose level, it is considered as pre-diabetes. If it exceeds 125, it is diabetes. Also for the random glucose between 141 and 200, it is pre-diabetes. If it exceeds 200, so this is diabetes. So checking at home by simple glucometers, if you have family history, it is highly recommended for early discovery of the diabetes or pre-diabetes. Also, there is other more tests which is happening in the hospital, like HbA1c, OGTT test. We are using these tests also for confirmation of the diagnosis.
So, as you correctly said, between 70 to 100 should be fasting. Fasting means at least no food, no water for at least 6 hours. So, you can do it at your home, at the convenience of your home. If you think that the reading is slightly high, also that should be enough to make sure that you book an appointment with your primary physician, general practitioners, internal medicine doctors, or endocrinologist is the first point of contact when it comes to diabetes. Dr. Nabil, one very important questions. Overall, we have received a lot of questions before this webinar. Patient, it's a very common, but probably most people don't know about it. The husband wife both have diabetes and they want to use one lancet. So, is it advisable, or it should be separately for each and every family member?
يعني better to avoid this practice because any blood transmission disease it can happen. So better everyone to use his personal kit.
Absolutely, doctor. So, Dr. Wissam, a case scenario where a person is affected with diabetes, what will be your approach with that? And if a person is generally affected with heart disease without diabetes, is there a difference in the treatment part?
Yes, definitely, Dr. Asia. Diabetes is a disease that can totally change my management plan when it comes to treating patients with cardiovascular disease. Either they already have confirmed or there is still a suspicion. First of all, as I mentioned, diabetes is a major risk factor for coronary artery disease or disease of the blood channels of the heart, which are called the coronaries. So, if the patient is already diabetic, I'm already suspecting that he's having coronary artery disease. Even if not now, in the future, he's at risk of having that. This will make me do more tests even for this patient, if, in more tests than the patient without diabetes because I have to exclude or confirm that the patient does not have any cardiovascular disease at the moment. Second, diabetes can change my treatment strategy, like the way I choose my medications. And currently, we have a new generation of drugs. They are very, very good because they have, although they are anti-diabetes or for high blood sugar, they are also protective for the heart, and I have medications also protective for the kidneys, like Dr. Sandeep said, because the diabetes will also affect your kidneys. Third, my diabetes will affect my targets because it will make me have stronger treatment targets. For example, if I have a patient with mild high blood pressure, usually if the patient is not diabetic and he doesn't have any other risk factors, I will tell him to exercise and stop salty food, and he can be managed without any medications. But if the patient is diabetic and he has mild high blood pressure, then I will be more prone or more eager to start medications with him. And even my blood pressure target will be stronger than a normal person. Like I want to control his blood pressure to be lower than 130 over 80, which is a lower target than for a normal person without diabetes. So definitely, treating a patient with diabetes will totally change my strategy for investigation and for treatment as well.
So you will always encourage people to take heart health checkups, at least to see what is the status of the heart, right, doctor?
Yeah, definitely. Because also for the heart and for the diabetes effect on the heart, not all patients have symptoms. Sometimes they don't have any symptoms, like when it happens with the kidneys or with the retina, like Dr. Lillan said. Sometimes the patient they don't have any problem with their vision or they don't feel anything abnormal, so they don't think why should I get checked. For the heart, it's sometimes the same. The patients don't have any symptoms yet. They can have early signs of cardiovascular disease. And the earlier the intervention, the earlier we take treatment steps, the more the benefit the patient will gain. So, yes, I definitely encourage a patient to do a cardiac checkup along with all the other systems as well.
Thank you, doctor, for that explanation. Dr. Lilan, I want to know uh, who are at risk factors for developing diabetes retinopathy. Who I want you to actually elaborate all kind of patients other than who should definitely come for the first visit, what you already mentioned, but who are actually at high risk and they should see a doctor so that this can be reversed or at least we can put some halt on the disease process.
Yes, so there's a long list. First of all, would be young patients. So usually they are insulin dependent diabetes mellitus. And secondly, there's a new entity, young with type 2 diabetes. This is a new entity which is surfacing. They are young patients in their 30s, but they have type 2 diabetes, maybe because of urbanization, diet, lack of exercise, smoking, stress. So these two groups, these younger patients are at higher risk. Then secondly, the duration. So by 10 years, about half the patients will have retinopathy. And by 20 years, almost 100% of the IDDM patients will have retinopathy and 60% of the in type 2 diabetic. Then thirdly, the uncontrolled hypertension. That is also a risk factor. Role of dyslipidemia is still not proven beyond doubt, but probably it also has a role. Then obesity, definitely yes. Smoking, then urbanization, high salt intake, and another important risk factor is pregnancy. So it is not only the duration of the pregnancy, it is also for 1 year after the baby has been born. So that entire period of almost 2 years, there's a risk for worsening of the diabetic retinopathy and also for the development of macular edema. They are high risk, just like the toxemia of pregnancy, where they have macular edema. Likewise, pregnant women who are diabetic are at a higher risk for macular edema and rapid worsening of the diabetic retinopathy.
Thank you very much, Doctor, for bringing this very, very, very crucial thing, because we generally think that, okay, once a person is diabetic, maybe probably after 10 years, 15 years, we will wake up and probably will start sending the patients to this. But most importantly, all the women or somebody, you have families, some woman who is having diabetes during her pregnancy, please make sure that that time also you should visit the ophthalmologist. In addition to your ongoing antenatal checkups, if your doctor is not suggesting, please do visit any of the ophthalmologists and make sure that you are not damaging your eyes and at a very faster pace. Not only that, after the pregnancy is over, make sure that you continue to visit till you are reassured that everything is going to be fine. This is very, very important thing for all of us to know that during all these topics, most of the viewers, if this is in your mind that why so much about diabetes we're talking, we don't have Dr. Preeti with us right now due to some medical emergencies. She couldn't join. Another very important topic is the diabetic neuropathy, wherein mostly patients are complaining of pain in legs and pain in feet area or insensitiveness to the feet area. So that will be probably, I'll just put little note on that towards the end. I'll go back to Dr. Nabil. That Dr. Nabil, you have worked, in different countries, probably in the Middle East areas more. Uh, what do you observe in your practice? What is like, is it different for people throughout the countries? They have a different perception about diabetes, or how do you find people think about diabetes, how serious they are about treating diabetes, specifically about UAE? Like, how do you deal with patients? At what stage they come to you? Are there people who come in an early stage, or we still need to increase the awareness? Please put some light on this.
Usually in Gulf area, most of the people they are aware about diabetes. As long as the percentage of diabetic patient in Gulf area is between 20 to 25%, which is very high percentage. So most of the people they are aware about diabetes, and they know the importance of annual checkup, as long as family history also here in Gulf area, it is very common. Also, this depend on the financial situation also of the country. It have a role. In less economic countries, of course, to do annual checkup for free or to have a medical insurance, it is a difficult. So patients are less aware and they are checking less, and usually they are presenting to the clinics or to the emergency by complication like DKA or hyperosmolar non-ketotic. Patients who have type 2 diabetes, sometimes they come with diabetic retinopathy already and blurring of vision and vision problems. Some people, they come, the first presentation is tingling and numbness of the feet. So of course, the financial situation plays role in this point.
Dr. Nabil, yeah. Yes, so we have a question from here from one of our viewer, Mr. Reddy R. Sabri. He is Reed R. Sabri. He is probably type 2 diabetes. He is trying to say that should I take the tablets even if my blood sugar is not high? I'm sure that he must be diagnosed with diabetes
Yeah.
some days in the
And for
past.
the patient, as long as patient is diagnosed to have type 2 diabetes, of course, the first line of treatment is diet, exercise, weight loss. But after failure of diet and exercise and weight loss, patient should be started on oral anti-diabetic medication. As long as patient start oral anti-diabetic medication, he should continue. And some patient is telling now I take the tablets and my sugar levels it becomes okay, so I will stop it. It is not like this. If you stop it, sugar levels it will go up again because already you try diet, exercise, weight loss, and it is not successful with you. So as long as you are on tablet, you have to resume it. And diabetes is chronic disease. Yes, in some cases of type 2 diabetes, type 2 diabetes, it may be reversible, especially in the patient who are obese and who are insulin resistant. Because weight loss is working with these patients. So sometimes if the patient lost 20, 30 kg, diabetes, it may disappear, but also you have to be cautious because risk is there and it may return again. Also now, bariatric surgery, it have a very big role in treatment of type 2 diabetes because most of the people who are type 2 diabetes who are obese, the cause of diabetes is obesity and insulin resistance. So once you treat the cause, diabetes, it may disappear. On the opposite side, type 1 diabetes, insulin a must, يعني oral anti-diabetic medication, it will not work, diet, exercise, all this it will not work because the pancreas is already not functioning, not secreting any insulin. So type 1 diabetes, they have to take insulin. It is a lifelong medication.
So yes, thank you, doctor. Doctor, I have one more question to ask. Since this year theme and probably till 2023, this is diabetes. This making diabetes care affordable. If not now, then when? What was the need of keeping such theme? Do you really think people are still not very accessible to diabetes care? People are not getting really treated well, or numbers are growing, still people are not able to reach to the right directions. You have any observation on that part?
Yeah. Of course, as I tell you, in the less economic countries, accessibility to the diabetes care is less. Because diabetes care, it needs a diabetes team, it needs endocrinologist, diabetes educator, dietitian, neurologist, cardiologist, ophthalmologist, nephrologist. It is a team care. So, يعني in rural areas, of course, all these subspecialties, it will not be available. Even as I tell you, in some countries, some people, they don't have medical insurance at all, and they have to pay to get the service, so they are not checking. So, يعني at least, as I tell you, in annual checkup, it is highly recommended in the people who have family history and also in the people who are over 40, just to confirm where you are. Are you diabetic? Are you pre-diabetic? You need follow-up, you don't need follow-up, and everything is fine. So يعني accessibility it is a يعني little bit hard, but يعني patient at least he should know from the media some awareness point regarding checking at least يعني even if he cannot meet a doctor, he can check with home glucometers to confirm where he is.
Thank you, doctor, for that answer. I would like to tell our viewers that we are always there for the patients. whether it comes to treatment or prevention, we give the equal importance to all that things. Whether you have insurance or no insurance, we have some very economical health packages to make sure that at least you know your health status. Um, Question for Dr. Sandeep. Doctor, if kidneys are already affected, if a person is already affected with diabetes, okay, his kidneys are also affected, can people with diabetes keep them from getting worse?
Yeah, of course. Like if it is, that is why uh, I initially talked about the screening thing. Like if by screening, when if we could pick up a patient with microalbumin stage, that is early stage, where the albumin leak in urine is say less than 300, between 30 and 300, then actually for 66 or 66 to 70% of such people may respond to appropriate medicines. So by of course by sugar control, and it's a holistic treatment needed: sugar control, pressure control, using of appropriate medicines for these things. So if we could find out if we could detect these patients early enough, we could for majority of the patients it really benefits. But unfortunately, many patients, or at least a few segment of patients, are found out when they have over proteinuria, that is more than 300 milligram in a day, or already the creatinine is high. There actually, unfortunately, complete reversal may be a difficult thing to attain. But of course, still there are various options to prevent its progression by using of appropriate medicines, just like Dr. Vizan was saying about using certain medicines which are beneficial for kidney as well as heart. Well, if they have hypertension, we can opt for certain medicines which are again as an independent cardiovascular and renal protection. So by these medicines and appropriate control of pressures and sugars, we could really go a long way in preventing or retarding the progression, though we may not be able to completely reverse.
No trouble.
And of course, then comes the other, or whenever, as in any other kidney disease patient, diet is a real important thing. Dietary adjustments should be made, which goes a long way in controlling or uh, retarding the progression of kidney disease, especially in diabetes.
Absolutely, absolutely, doctor. You are very much right. Whether it comes to heart, eyes, or kidney, or neurology, it's a disease to be really acted well. So, all the viewers, please be there. I'm going to ask now the question for the day. You may be one lucky winner. There will be one lucky winner who can win and really good health package, at least related to diabetes, since we believe in accessible to world care. So my question is, uh, what is the theme for World Diabetes Day 2021? Write your answer in the comment box. The right first answer will be the winner of the question. Okay, coming back to the topic, Dr. Nilan, uh, please let us know the patients, or for the doctors or for physicians, your recommendation for follow-up, how frequently they should come, when they should come, a complete eye journey for all the diabetic patients.
So at the time of diagnosis, I expect the treating physician or endocrinologist to send for a baseline mandatory examination. Thereafter, the ophthalmologist will decide how frequent the follow-up will be. So if it is a mild diabetes, say mild non-proliferative diabetic retinopathy, so in the very early stages of retinopathy, a checkup after 1 year will suffice. On the other hand, if there are moderate retinopathy, moderate, so then once again, if there are many risk factors like older patient with long duration of diabetes, poor glycemic control, obese, smoker, no exercise, then I may call the patient at 6 months. But if he is fairly healthy, then I may call him at 1 year. So it is not that it's just a annual checkup. It will vary depending on the duration, depending on the type of retinopathy. So mild retinopathy, 1 year. Moderate, we may call back in 6 months. If it is severe retinopathy or proliferative diabetic retinopathy, we have to treat right away. And thereafter, the follow up may be every 3 to 4 months or every 6 months. So, just to re emphasize, mild retinopathy with no other risk factors, 1 year follow up is will suffice. But moderate retinopathy with a lot of other risk factors like obese, poor glycemic control, uncontrolled hypertension, I may call back in 6 months. And of course, in the severe forms, we have to treat right away.
All the viewers there, please, you can put your answers in the comment box. Once again, I'm going to ask the questions. We have some answers, but they're not the correct ones. So I'm going to repeat my question. What is the theme for World Diabetes Day 2021? What is the theme? What is the name of the theme? Please mention in the comment box, and you may be the winner for this prize. Dr. Wissam, what is the recommended follow up for anybody having diabetes, and why is it important?
Regarding the follow-up for diabetic patients uh, who have documented cardiovascular disease, or even they are suspected to have this disease, it will all depend on the patient. If the patient already has documented coronary artery disease, then a monthly follow-up actually can be done for the patient till the patient is controlled from cardiac wise and all the other risk factors. I can follow up the patient closely till I make sure that the patient is controlled on his medications. If the patient is asymptomatic or doesn't have any symptoms or doesn't have any cardiovascular disease, then like 3 months follow-up is okay to check his glycemic control and to check that he doesn't have any new symptoms. If the patient is symptomatic and he has actual symptoms, then the patient should seek the medical attention immediately. And my concerning symptoms, the symptoms that I need to tell the patient about, especially the diabetics, are mainly the chest pain. If the patient is having chest pain or chest discomfort, especially if it's in the center of the chest or it's related to exercise, then the patient should immediately seek medical attention. Or if the patient has exercise intolerance, because for diabetics also, not all patients have typical symptoms. They don't always have chest pains. Some patients develop exercise intolerance, and some patients just have like swelling in their legs. So I have to emphasize for any diabetic patient that if you have any abnormal symptoms, you have to seek medical attention as soon as possible. The importance, because as I said, diabetes is a multi-systemic disease. It will affect many systems, and it's duration dependent. So depending on the duration you have had diabetes, the more risk you have. And as Dr. Leland said, 10 years or more, you are already high risk for developing all other complications of diabetes, including for the retina, for the kidneys, and also for the heart. So it's important to prevent these events from happening before they happen, which is what we call primary prevention, which is preventing something from happening. And if the patient already developed these adverse effects or complications, especially cardiovascular events, then my target is to prevent the patient from having another one, which we call secondary prevention, because all these can affect the outcome of the patient and definitely can affect his life and his morbidity, what we call morbidity, and his quality of life. So definitely a follow-up is very, very important for all these patients, not only for the cardiologist, for all other specialties.
All the people who are there who are listening to us, or anybody in the family, let me tell you my experience. People are really increasing in high blood pressures, and when it comes to high blood pressure in young, it has to be definitely seen by the cardiologist as well. Similarly, if a person is affected with diabetes, make sure at least you have one visit with all the specialties, irrespective when it was diagnosed, irrespective what is the age of the patient, irrespective how much you know about it, irrespective whether your primary physician is referring to other specialties or not. Make sure that you do it, because this is really, really, really justice to your health. So moving forward, Dr. Nabil, will insulin gain weight?
Yes, yeah. Usually most of the patient they are complaining that insulin it causes weight gain, but this is a common side effect of insulin. And as long as you are type 1 diabetes, there is no other choice. You have to resume insulin even if it causes weight gain. You have to continue. Sometimes we can to, and sometimes we try to change from long acting to another brand of long acting. Maybe weight gain is more with a special brand. Sometimes it is happening, but in general, insulin it causes weight gain, of course.
Thank you, doctor. Now we have the first winner for the question, who has actually wrote the right answer. Thank you all who have participated. We have Miss Marsha Kanan. Access to diabetes care, if not now, when, is the theme for World Diabetes Day. Congratulations, Miss Marsha. Please inbox us separately your details so that we can reach back to you with your health package, what you have won. Congratulations for that. Uh, but stay with us on during this program. You may be winning another package, so you never know. So I'll come back to Dr. Sandeep. Dr. Sandeep, kidney and food. I'll now this topic before we, because we are proceeding towards the end of the session. Two very important things what all patients want to know is the food part and the lifestyle part. So patients affected with kidneys, what is that particular thing as far as food is concerned that they should do and don'ts, and yes, and keep on going. So
Yeah,
any suggestions for them, please?
that's very important because we often see people with when they have dietary indiscretion, they come back when they come back for follow up. Their creatinine is high, their urine protein is high. So diet is a very important part in management of kidney disease. So basically, what we advise is to reduce the protein intake, especially animal protein, animal origin. So basically, we ask them to, from a kidneys perspective, of course, there is dietary adjustment for the sugar management, that is different. But when it comes to nephrology or kidney specific management, yes, the primary thing is to reduce animal protein as much as possible, to have a predominantly vegetarian diet. But some people cannot go without animal protein, especially in this part of the world. So then I would usually advise to at least avoid red meat as a whole, and maybe chicken or fish once or twice a week. That is what I usually advise. But if somebody can be a vegetarian, that will be fair enough, better. And then comes, of course, to reduce the salt and reduce the oil. Salt, sodium has a direct vascular toxic effect, or toxic or damaging of the blood vessels, small blood vessels. So naturally, and kidney disease in diabetes is a disease of small blood vessels. So naturally, uh, salt intake should be reduced. And also, many of our patients would have swelling in the feet, as I discussed before, and these swelling will increase when if they are continuing to take more salt. So, and indirectly, increasing salt will increase the chance of blood pressure worsening, which will indirectly damage the kidney also. So, naturally, salt intake reduction is an important thing. And then comes reduction of oil, not from the kidney side, but as I told before, there is a direct relationship, correlation between kidney and heart or kidney and cardiovascular health. So when the kidney is at fault, naturally the cardiovascular risk increases. And so from that perspective, it is well to reduce the oil intake also. So these are general advice for our diabetic kidney disease patients. And many of our diabetic kidney disease patients do have swelling, So it is important to reduce water intake when they have swelling. Many people or many patients come to us and say they think that whenever there is a kidney disease, the dictum is to increase water intake. That is what people generally believe. And then many patients come to us with increase in swelling, or like fluid in the lungs and things like that when they continue to take more water. So whenever there is swelling, it is always better to, whenever there are any features of fluid overload, water overload, like swelling, it is always better to reduce water intake. So these are the general dietary adjustments which we advise for everyone.
Thank you. Thank you, Dr. Sandeep, for that. The similar question with Dr. Nabil. What is your advice for all the patients for general lifestyle, how they can change, and any specific food pattern they should stop?
Generally, we are recommending for 30 minutes of daily exercise. This will help to reduce blood glucose levels, and also it will help to improve the insulin sensitivity. Also, regarding diet, we are recommending to try to avoid carbohydrates and sweets as much as possible, because carbohydrates, this is the main source of sugar, and once you eat carbohydrate, it will convert to glucose inside your body. So, we are recommending less consumption of carbohydrates like rice, pasta, potato, bread. And patient, if he don't have any kidney problem, he can eat meat, more proteins like meat, chicken, egg. Also, patient can eat unsaturated fat. Yeah. Unsaturated fat, it is a good fat, like salmon, tuna, nuts, avocado, olive oil. So all these items is recommended for the prevention of type 2 diabetes.
Thank you, doctor, for that. Dr. Wissam, your advice for as far as food is concerned, specifically if a person is already having high cholesterol, high blood pressure, and now the diabetes also, what is that advice you definitely give to all patients coming with all three?
Definitely, for the patients coming with high cholesterol and diabetes, I will be more keen on lowering their blood cholesterol. And for to do that, I have two major approaches. First approach is lifestyle, as Dr. Nabil said. It will be the same. I have to emphasize on the patient that he needs to have regular exercise, 30 minutes per day, or at least 4 days per week. And by exercise, I'm not just referring to walking. Walking is okay, but I need an exercise that will increase his heart rate. So running will be preferable. And for also, I need him to have certain diet. I have like some diet that he has to avoid, and other diets that that's also preferable for the patient. The diets I need him to avoid are the fatty food that's full with unsaturated fatty acids, saturated fatty acids, including the deep fried food, and food high in sugar also, because in the body the carbohydrates are metabolized to fat. So also avoiding carbohydrates is good for your cholesterol as well as for your blood sugar. So I will emphasize on the patient to stop all deep fried food and fried food, and I want him to avoid all the milk, especially the full milk, the full cream milk. And I want him to focus on the vegetables, especially the high fiber vegetables. They are very good for your cholesterol. And I want to emphasize on the healthy cholesterol or healthy oil, because not all oil is unhealthy. And by healthy oil, I mean the polyunsaturated fatty acids, like they are what they are found in fish, including salmon, and like in olive oil. These are the healthy oils that I encourage the patients to consume. So definitely, and second approach after lifestyle modification is medication. If the patient is diabetic and he has high cholesterol, then he has definitely to check with his doctor because he may need medication. As I said before, it's in patients with diabetes, I will be more prone to starting medications along with lifestyle adjustment because diabetes is a major risk factor. That's why I will always be keen on starting medications along with lifestyle modifications.
Thank you, Doctor. I hope Ms. Farheen, you got the answer what Dr. Wissam said. Dr. Lilan, though this is eyes, but still anything you suggest as far as food is recommended, how to prevent or delay this, signs in eyes as far as retinopathy is concerned. Do we need to be, cautious about any particular foods? So,
Articles
Dr.
that probiotics may help. And if the macula is involved, sometimes we even give antioxidants. But otherwise, the dietary restrictions holds good, just like for the general body. So nothing specific.
So
Controversial
that
role of probiotics and antioxidants in maculopathy.
I'm sure that people are really concentrating on probiotics as well as the antioxidants, and at least that will be a benefit or doubt for them in the current scenario. So, I have a question for the viewers here: that what is the when is the first recommended checkup after being diagnosed with diabetes with the ophthalmologist? When should you go to see an ophthalmologist once you're diagnosed with diabetes? When it is advised? Just write your answers in the comment box and we will have our first winner when we have the right answer. So moving forward, so we discussed everything mostly about diabetes. Diabetes is a topic which is never going to conclude. That's why we say more than 537 million currently are living with diabetes. The unfortunate part is most of the people don't know about it. So the best thing is get a glucometer if it is possible and check it today. Don't think about age. Don't think you are young. Don't think you have a child who probably cannot get affected. Hereditary, more than hereditary, it's also now the lifestyle which carries a huge value. Mostly children are, not doing much activity. The lifestyle is really hampered. So make sure that you take early action and you take proper advice, seeing your doctors, taking care, and also assessing the right information on the Google. Please don't consider Google as your doctors. There we have specialists who know better than definitely any Google on this earth. So seek knowledge from the right doctors. Uh, do we have any answers? So I'm going to repeat the question once again. When a person is diagnosed with diabetes, what is the recommendation for visiting the ophthalmologist first time? So I'll give you an option to make it easy. Once you're diagnosed with diabetes, is it at the time of the diagnosis? Is it after 3 years of the diagnosis? After 5 years of the diagnosis? When it is recommended to see the ophthalmologist? So you can write your answers in the comment box and we will have our first winner there. So in the meantime, we would like to proceed our session with the closing notes. Dr. Nabil, I want you to advise something very important for all the patient, a take-home message. I'll also request to summarize in Arabic and English both.
Yes. Take home message: do diet, exercise, weight loss, to prevent diabetes. جميع الناس بممارسة الرياضة والحمية الغذائية للحماية من السكر.
Thank you, Doctor. Dr. Wissam, Arabic and English both. Take-home message for all the viewers.
Take home message for all the viewers that if you are a diabetic, newly diagnosed, or if you have diabetes for a long time, you should always do a cardiological checkup, and the doctor will decide if you already have cardiovascular disease or not, and he will discuss a management plan with you, and he will look for other risk factors. So you will have a comprehensive plan for all your risk factors and including diabetes. In Arabic لو أنت مريض مصاب بالسكر حتى لو حديث او بقاله فتره، فانت لازم تراجع طبيب القلب، لان طبيب القلب هيعمل لك فحص شامل وهيدور على عناصر الخطوره الاخرى اللي عندك، ويحط لك خطه علاجيه شامله علشان تقدر نظبط بيها السكر ومضاعفاته على القلب والاعضاء الاخرى، بحيث ان احنا نكون بنعالج كل حاجه كوحده متكامله. Thank you. شكرا.
Thank you, Doctor. In the meantime, I'll ask one question. Once again, the same question. When a person is diagnosed with diabetes for the first time, what is the recommendation to see an eye doctor? Answers: at the time of diagnosis, after 1 year, after 3 years, after 5 years. Write your answer in the comment box. I'll take the takeaway message from Dr. Sandeep in English and Hindi if he likes to.
Previous doctors told. Early checkup is the key for early diagnosis, and as I told before, if it can be diagnosed early enough, we could prevent it from progressing. And as just like in heart or kidney or brain, these organs doesn't regenerate or doesn't come back once it is at fault. So it is very important to prevent its progression. And that can be only done once it is diagnosed early, for that matter. And so early checkup, preventive checkups are very essential in preventing the progress and early detection of the disease and preventing its progression. Hindi, yeah, I'm not very much comfortable. Yeah.
Okay, doctor. Sure, sure. Dr. Lilan, your takeaway, take-home message. Since the question is also there, we're still waiting for some more replies, though we got one correct answer. But what is your take-home message for all the people living with diabetes or some way having people with diabetes in their life? What is the take-home message from you? If you're comfortable, definitely in English, but if you're comfortable in Hindi, we would like to know from you.
So diabetes can cause blindness. That is the bottom line. And we can prevent the blindness with early treatment. Therefore, at the time of diagnosis, check your eyes, and thereafter, an annual checkup is mandatory. The doctor will decide if you need to have your eyes checked before the annual checkup.
Fine, doctor. So, would you like to speak in Hindi as well?
I'll pass.
Okay, thank you. I think we have got some answers. I would like to comment on that. We have the first right answer from Miss Mariam Kitmitu. She wrote after diagnosis, but then she changed her mind and said after 1 year. So now probably we have now the right answer with Michelle Javali. She or he has recommended, it is recommended directly. So congratulations, Michelle, you have won an annual health, you have won a diabetes health check package. Please write back to us, inbox us with your details. We shall get back to you with your winning health package. Congratulations again for that. And before I conclude the session, I would like to give brief note since Dr. Preeti, our consultant neurologist, is not here today with us due to some medical emergencies. I'd like to give a short two-liners that mostly people will come with leg pain, foot pain. If you have some symptoms, please discuss with your doctors. This may be the advanced sign of diabetes neuropathy, and without neurologist, this treatment is not possible to be taken care of. And if in winters, if you're really not feeling the difference between heat and cold, that means also that we need to see a nephrologist. So when we talk about the multidisciplinary approach about diabetes, we don't say that, okay, now you have to really go to all of them, but definitely you have to make a schedule to visit all of them in 1 year. So over a period of 1 year, a person, I'll summarize the whole program. A person in a pre-diabetes group, probably ranging 100 to 125 blood sugar values, should see a doctor. Once a person is diagnosed with diabetes, should see a doctor. Any of the physician is fine. But if the diabetes is not controlled, then the recommendation is to see an endocrinologist at the same time. And definitely visit all the other branches, because when diabetes happens, it's a duration dependent but definitely multi-organ affected disease. So, with this note, I wish you all the very best on behalf of the entire Prime Healthcare Group. Stay healthy and stay blessed. We'll be coming back in next webinar soon on Men Health on 21st November. Till then, thank you.
Thank you.
Thank you so much.
Thank you all. Thank you.
Thank you.